Zika virus is now what's come in a line of a couple of viruses that are mosquito-borne. So that's one of the newer versions. So there certainly are other viruses that are transmitted human to human by mosquitoes. And that's probably where we gain a little bit of knowledge and can say some things about what we expect and could expect with this virus. We advanced a little bit more in 2007 after the outbreak in the Micronesian Islands, then again after the 2013 outbreak in Tahitian Islands. We learned from that. But in both of those places, the numbers of people were small compared to what we're now seeing in Brazil, where they're estimating. The estimates go anywhere from this past season, 500,000 to up to 1.5 million. If you use chikungunya as the example, or actually if you look in the Micronesian Islands or in Tahiti, with Zika, and then if you look at this chikungunya and the way it came here, in each of those cases, there was a year where there were a large number of cases, and if you looked for it the next year, you almost could not find it. So what happens is, on a population basis, there's enough immunity so that when it's rare then, rather than so many people getting it, plenty of mosquitoes. So the mosquitoes haven't changed, but the numbers of people that are getting infected and then can put it back in the mosquito to put it back in another human is what's gone way down. So now we have something that's we've never had. We have other things that rarely cause this microcephaly, this presentation or brain malformation. It's really partially brain destruction or brain maldevelopment is what it really is. It's much more severe, it turns out, in these cases with Zika than we would normally see with other infections that cause this. Now that we've identified this, and every other infection that causes this type of malformation, there are milder forms of it, and it seems to be particularly related if the mother gets it later in the pregnancy. So we've now seen what the worst form of it is. What we don't have clear yet is what are the more mild forms of it. But mild can mean, in some of these cases, it can mean retinitis or an eye disease that goes to blindness. There can be deafness, as there is. That's the virus that people study here that causes one of these syndromes as well, and they look at the hearing impairment that it causes. So there can be other things that happen, and that's the part we don't know yet. I mean, people should be aware of it. In terms of worry about it, I would say no. Does it mean that you shouldn't take the opportunity to clean up, areas in your yard that might breed mosquitoes? Why not? And sort of, it cuts down all the mosquitoes altogether. But it isn't to say there couldn't be a transmission. We certainly have the mosquitoes. If somebody would come here that happens to be carrying it and the timing was right, because the timing, people don't carry it for months, so it would have to be right at a time when they could transmit. So the timing of somebody coming in would have to be right. The mosquito density would have to be right. Mosquitoes only fly 100 yards in their lifetime. They don't, buzz around the whole city. So, so the all the things argue against. And if you use chikungunya as the example, there were people with chikungunya in the state. Nobody got it. And really, of the 5,000, they were in many different places in the state, but in the states. But only the area in Florida, again, probably high enough mosquito density, high enough population density. That's what's really driving the epidemic, particularly in Brazil. This isn't a disease of the suburbs necessarily. It's a disease of the favelas, where there's people living in very concentrated areas with lack of infrastructure development, so not good sewers, not good garbage pickup. So you have lots of places around where the mosquitoes can breed, along with the big density of people.